Hi, my name is Gabby Di Lorenzo and the production of this video was done on the 7th of October, 21st and 28th of September. In this video I'm going to demonstrate airway management skills, putting a person in the lateral position, doing a laryngoscopy, inserting an OPA and an NPA, doing positive pressure ventilations, 12 per minute, using a bag valve mask, and also doing the triple airway manoeuvre. Demonstrate putting the patient in the lateral position. Place the patient in a supine position with the head support, and then I would get the close arm and place it over the body, and the close knee I would extend up, and her far arm I would place outwards. Then I would grab the hip and the shoulder and gently roll her over and extend the knee out at right angles and place the arm down by her body. Then you would extend the patient's neck and rotate it towards the ground to allow any fluid to drain out. And a common error is not extending the patient's head so that the fluid cannot drain out. I'm going to demonstrate doing a triple airway manoeuvre. Placing patients in a supine position and adults with a 2 to 5 centimetre pillow under their head. Children just lay them flat, and infants with a pillow under the upper back. First I will do the head tilt and chin lift. Placing my left hand, pointing my thumb towards the nose on the forehead, and placing my right hand on the chin, and just gently lifting the chin up and pushing back on the forehead. And then I would do the jaw thrust, which will be placing your hands on either side of the patient's face, with your fingers on the mandible lifting up and your thumbs pressing down on the zygomatic. Common errors in doing this is pushing too hard back on the forehead of the head and hyperextending the neck. Now I'm going to demonstrate doing an OPA. Indications for an OPA are an unconscious patient and using it as a bite block. Contraindications are if the patient has trismus or a gag reflex. To insert the OPA, you must first lubricate it with water or the patient's saliva. Then you must measure it against the jaw to make sure it fits from the tip of the mouth to the angle of the jaw. Then you insert it with the natural curve facing backwards, inserting it halfway and then gently turning it and continuing to insert until it fully goes in. Common errors with this are using an OPA that's too big and not measuring properly. And once this is inserted, this can occlude the patient's airway and they actually won't have a patent airway. Now I'm going to demonstrate inserting an NPA. Indications for an NPA are conscious patient with trismus, and contraindications are middle to third facial fractures and significant nasal trauma. To insert the NPA, you must first measure it from the nose to the earlobe. Then you must lubricate it with KY jelly and point the patient's nose to their eyes and select the biggest nostril. Putting it in, you slide it from side to side and gently insert it into the patient's nose. Some common errors with putting in an NPA are selecting NPAs that are too wide and do not fit the nostril. This can cause further nasal trauma. Now I'm going to demonstrate using a laryngoscope. The patient should be placed appropriately with something under their head to support it. Then we would open the laryngoscope, checking that the bulb is secure and the light is on. Then placing the laryngoscope in your left hand with the grip as shown, and placing your right hand on the patient's head, pulling it back into a bit of a sniffing position. Putting the laryngoscope in, I would sweep from right to left, pushing in, pulling up and away from myself. A common error is that professionals don't pull up and away from themselves enough, chipping the patient's front teeth. Now I'm going to demonstrate using positive pressure ventilation with 12 ventilations per minute. I'll place the patient in the supine position in the triple airway manoeuvre and already have an OPA in. I'll get the facial mask and roll it over the patient's face, putting my index finger and thumb in a C-shaped grip and my other fingers under the mandible holding it forward. I'll ventilate 12 ventilations per minute with 10 mils per kilo. Ventilation should be taken out over 1 second, as a common error is ventilating too hard and fast and causing damage to the lungs as they are very delicate.